Hello, everyone. Thank you for joining us today. I wanted to share from the top that this is going to be really unstructured. This is intended to be technical assistance for people who are thinking about applying for a grant or are in the process of doing an application right now and have questions on the application process about either the application or your particular project. There is a Q&A option in this meeting. So if you're not comfortable unmuting and speaking up, you are welcome to use that Q&A to be able to ask a question. You can also just put questions in the chat and we can go from there. Questions. I'm going to go ahead and share my screen and walk you through a little bit of the information that is out on our website around the different projects and information that we have available. Oh, yeah, go ahead, Heather.
So I did have a couple questions. I'm just coming in a little late here. Okay. On the application itself for the renewals, the Part 6B for treatment, is that like, do we directly have to provide that on site, or is that like we help clients on site and then take them somewhere? Trying to skirt around that by seeing what I can get away with.
Yeah, so HUD has not given any specifics on what they mean by that. Okay. But our interpretation and the interpretation that has come from the National Alliance to End Homelessness, who has been analyzing this NOFO pretty closely, is that it does have to be on site. It does not have to be provided by you. So okay. It could be a partner organization that comes in and has, like outpatient group or something like that in your location. But it does have to be on site, does not have to be by you. They also have not been specific on the level of that service, like of what qualifies as treatment services.
Right, that's what I was trying to figure
out.
And
Carl has his hand up. Carl might have some ideas in there too.
Okay, thank you.
Hey, yeah, Carl Soderstrom here. I'm the founder and CEO of True North Recovery out here in the Mat-Su. We got shops up in Fairbanks and Ketchikan. Just wondering if there's any provisions or language that you've seen pertaining to telehealth and being able to provide. So my understanding is telehealth is an option statewide for us, and it really goes off where the client is located. So if a client is on-prem or on-premises and our providers are telehealthing in, it's not actually considered telehealth. It goes off of where the client is. And so would that be an option through partnership with other organizations in Anchorage, or would that be a challenge, I guess, was my question.
So that's another space where they haven't been clear. I know that there are lots of services that are allowed to be provided via telehealth and are currently being provided via telehealth, billable. So I would anticipate that is valid. That is a valid type of on-site treatment being offered, via video or however that happened, however that telehealth looked. I see Amanda's question in there in terms of scattered site transitional housing. So there still are those same requirements in there, whether it's scattered site transitional housing or whether it's all in one location transitional housing. I think that with scattered site, providers are really going to have to lean on those partnerships and those connections. So as you make referrals to other providers that are specifically in your question, treatment providers, you would be documenting the supports and the hours that are being provided through that partner, not necessarily your staff directly. But that does make it harder with the whole, kind of consolidation of effort when you have scattered site. New projects are defined as projects that are not currently being funded with Continuum of Care funds. So a new project could be something that is existing right now and being funded through other fund sources. And this is new to Continuum of Care funds. So not even necessarily new to HUD, just new to this type of funding. Go ahead, Ben.
Morning. I guess one question we had, are there, so I know the NOFO, it touches on rental assistance provisions as they apply to like THRHH, those joint THRHH. Do we know if there's anything in policies or like prohibitions around rental assistance on a new TH project, if that was part of the budget for new TH?
In terms of like minimums or maximums, there's not prohibitions on that. That type of assistance has always been an allowable expense to a transitional housing project. It can't be, the Continuum of Care regulations are that a person's contribution can't be more than 30% of their income. So you would have to be adjusting your occupancy fees or rents, however that looks, to make sure that the portion that is required to be paid by the client isn't more than 30% of their income.
Okay, and it's totally okay on this new TH to have that be rental assistance on sites owned by the applicant.
Yes, so it's not rental assistance at that point. Like,
right.
Yeah. So, but yes, you could have a property that is owned by the grantee and you're providing the transitional housing services in that location.
Mm-hmm.
Yes.
Gotcha. Thank you.
Go ahead, Heather.
Hey, it's actually Laura. Sorry, we're
Oh.
sharing a computer
No,
today.
go ahead.
I was wondering if we figured out the supportive services only piece, and if we have a supportive services only project, if it can serve another COC project.
So supportive services only projects can't be dedicated to any specific project. So the way a supportive services only project is going to work is it will get referrals through coordinated entry. So you'll have no guarantee where that person comes from, for example. Supportive services only projects can only be serving people who are experiencing homelessness. So the actual definition of homelessness. And then once they have been housed, they can have an aftercare policy that applies or provides up to 6 months of additional supports after that person has moved into permanent housing. So it gets tricky that you can't say like this supportive services project is dedicated to this rental assistance. It's you won't have control over who gets referred into it.
Okay.
There can be SSO. Oh, sorry. Yeah, go ahead. Keep going.
No, you're good. So if, like, say RISE had new referrals, then those new referrals into RISE can also have a referral into the SSO project, into a separate one?
Okay, yes, but they couldn't happen at the same time together. This person could be enrolled in, and I guess my question would be RISE as PSH or RISE as something else?
It would be RISE as PSH. I'm just
Okay.
trying to figure out a supportive services budget in RISE in order to kind of
Mhm.
reduce it down and increase rental assistance.
Mhm.
So I'm trying to figure out if we do SRA as supportive services only, if any new referrals can get referred to SRA for supportive services and then get help applying for RISE. and then get a referral into RISE, if that supportive services can then continue and we don't have to use the supportive services funds in RISE for those new referrals in.
Got it. So yes, a person could have a referral to a supportive services only project and a referral into a permanent supportive housing project. Their SSO support would be while they are navigating the intake into the other project, and then that support would end, the RISE support would pick up. But
Okay.
it wouldn't be, it's not like a guaranteed one-to-one match. Not
Okay.
everyone who gets one referral would get the other referral. It would all depend on the prioritization at that point.
Okay, that sounds good. And then kind of piggybacking on what was just kind of talked about, I thought that there was something in the NOFO that stated that we couldn't own the properties that we're putting people in. Was it just for supportive services only? Like you couldn't provide supportive
Mhm.
services to people
Yeah,
that
so
are in your
can't-
units?
Yes. So and it's around, yes. So the transitional housing, the ownership of the property, like that's fine. It's like it is right now. If you had a transitional housing / rapid rehousing project, it's just dropping the rapid rehousing off of it. That one's a little bit more cut and dried in terms of like what's allowable. If you have a supportive services only project, you can't pair that with property that you own. Like you can't pair that with rental assistance that already exists, or properties that are owned by the grantee. And there's a specific section that looks at that. I'm going to see if I can find it. I'm going to have Yvonne look that, find that specific section. I'm going to get to a couple of these other questions. So
Yeah, no, you're good. Thanks,
hold
guys.
that. I will get back to you on that. SSO for DV only. SSO is an eligible project type for the DV bonus funds, if that was the question. Yes. What can count towards the 25% matching funds? That's a good question. So what can count towards the 25% matching funds is funds that don't come from another federal source that isn't allowed to be matched for federal funds. It does have to be support for the project. So if you couldn't say, for example, we have this grant over here that funds this case manager that works on this other project, and so we're going to count that as the match. It has to be part of this project. But really the biggest restriction is that typically federal funds can't match other federal funds. So if you have a specific source that you have a question on and want to know if it's eligible, you can definitely reach out. But that's the biggest piece there. The verification of immigration status. So the immigration status section is a section that is bonus points for our collaborative application. So if we can show or demonstrate that all of our continuum of care projects that are funded, that are selected to go forward for funding, are doing that verification using SAVE or another organization. So once we have that information on the grants that have been selected and are part of the priority listing, we'll have that conversation individually with them to find out if that's something that they're either already doing or willing to do. And if so, then we'll put that information into the collaborative application to get those 4 preference points. But for right now, what we decided was not to make that a requirement of projects coming in. We would look and see what projects came in. I am not super familiar with the SAVE program or the SAVE process for verifying that information. So I can't really speak to how complicated it might be or what might go into that. But if that's something that you're not sure of your organization doing or not doing, being able to do, don't let that be a barrier to putting in an application. We do not know the figure for the slight increase that renewal applications can ask for. I can tell you that it's an FMR increase. It's probably going to be a couple $1,000s. It's usually applied automatically by HUD. So when we see the eSNAPS information, we should know that. But it's tied to the rental assistance in those renewal grants that are permanent housing projects. So sometimes you can calculate it yourself by looking at prior years and seeing how many of each unit type you had in your project, and then looking at what the FMR increases were from last year to this year. If your project doesn't have rental assistance, then those don't apply.
Hey, Jessica, I had a quick question. For the application, where a lot of the language is just using like histories of working with unsheltered and homeless individuals, DV would still count under the category 4, so we can answer yes, even though we're not a homeless shelter. Okay. Yep. Perfect. Thank you.
I am going to share my screen really quick because I want to make sure you guys know the resources that we do have out there available for people who might be interested in these grants. So on our website, we have the NOFO landing page. That has a link to the full notice of funding opportunity that is released by HUD. I'm sure you guys have realized that a lot of the links right now on the HUD website around COC funds are broken and don't go to the place you thought it would. So this is hosted outside of HUD. So you can click on this and it takes you to a PDF of it. It doesn't direct you back to the HUD website where it might not actually exist there anymore. We also linked this analysis by the National Alliance to End Homelessness. They did a really good job of kind of breaking down the information in this NOFO into something I think a little bit more digestible. So we did link to that. And then we have our timeline there as well. In the meetings section, there will be links to go to, today's technical assistance session. There will be another one next Wednesday where the link is available there. And then after we're through this process of the applications coming in, we will have some technical assistance on how to use eSNAPs and how to get your application into eSNAPs, particularly for new grantees who maybe haven't used that system before. And then we'll always have links to any presentations or recordings of any of the meetings as they happen. So the kickoff meeting that happened on the 20th, the PowerPoint slideshow and the recording are available there. And then all of our documents here, so the applications themselves, the instructions are located over here on the side here. Not linked on here, but we can put links up if you think that they might be helpful. We also have, these are documents that NAEH has put together. They held a webinar as well and had a lot of questions come in and compiled them together into this frequently asked questions document that has their interpretation of some of the information in the NOFO and the questions that people have had. Here's some information, in fact, around the immigration status verification. There are some organizations that are exempt from SAVE, and so they can't actually even access that system if they wanted to do that. And so there's some information there for grantees that might apply to. They also did this document that's a side-by-side comparison of last year's and this year's NOFO. So things that were allowed to happen last year that aren't allowed to happen this year and vice versa, being able to see them laid out side by side next to each other. And then the last document is a side-by-side comparison of the scoring. So we're able to look at how many points certain things were worth in the old application and what they're worth in the new application. And that is more about our overall community application and not necessarily the individual projects themselves, but that can be helpful if you're thinking about what makes a strong application, looking at how the community is scored on the availability of different things.
Else, I guess just going back to the treatment question at the beginning, is there a definition by which ACH wants us to operate by in terms of like how we're landing on saying yes or no, basically?
Yeah, so we did
Especially for the level side of it, which I know we don't really know.
We did submit and ask a question through the traditional HUD section and the NOFO specific one. I can share that. I mean, I've been on a couple different conversations with people across the country that are asking these same questions. So far, across everyone I've talked to, we've gotten one response to a question we've submitted. So I'm not holding my breath that we'll get a whole lot of answers from that, but I will say that the conversations that have been happening with other continuums of care, particularly around like those levels of supports, have really been to think about how you would justify it. You know, if HUD were to come back and say, you know, there was this requirement to have on-site treatment services, and what you had, I'm going to give a crazy example that I think is really obviously not what we're talking about. And your answer to having on-site treatment services is that you have a table in the lobby with a whole bunch of flyers of different treatment centers, and it's there for everyone to see. I think that would be really hard to justify versus if you had a visiting treatment provider doing on-site groups and talking with people about the options that are available in our community. I think that fits. And then the full other side of the spectrum, you know, an organization that has on-site, you know, clinical treatment services as part of their actual program, that's more like a residential treatment type program, is obviously checking that box. So I think there's a lot of nuances in the middle there that it's kind of hard. So I am not the person who will be scoring these applications. That's done by a committee. It's called the Rank and Review Committee. It's made up of people who aren't applying for grants and that are part of our community. So it's people from, for example, like the Anchorage School District Child in Transition Program, faith-based organizations that provide services, people who are maybe working at a shelter, or people with lived experience. So the people who are going to be scoring these applications are also going to be basing their scores off of how well you explain how that met that criteria. So I think in terms of the spaces in the middle of, you know, what might qualify as on-site services and what level those might be at, I think it's the way that you are going to explain to someone who is not familiar with your program how that level of services provides those connections. You know, kind of back to that flyers on a table. If nobody is telling anyone about those flyers or ensuring that they're in the right language or talking with them about what that actually means, that person is probably not going to connect with any kind of treatment services because of that flyer, versus somebody who comes on site and talks on a regular basis with the people who are staying at that program about the resources that are available, what it looks like, what the intake process looks like, what they can expect. They're a lot more likely to accept those services at some point, and is likely something that will score higher.
And for backing that up, I guess, so since that's kind of, that particular treatment question is kind of like one of those yes or no in the tables, are you thinking like generally we also want to explain that in kind of that partners and services section of the narrative, basically?
Yep.
Gotcha.
Yeah, if you are providing them yourself, I would say in that partners section, make sure you're breaking out services that are provided by you directly and services that will be part of partnerships in both the housing services side of it and the healthcare connection side of it, which treatment would be part of that.
Gotcha. Thank you.
I'm getting a little bit of mixed messages, and I think there's a lot of confusion on this subject, but what I'm hearing is active treatment plan is going to be required, or some plan of care, not like referral to or providing the option to engage in treatment. Like there has to be an active treatment plan, and that's significantly different than making a referral or providing access to treatment. I think the intentionality is essentially engagement for resource. Not saying I'm pro that, just that's what I'm hearing the intent is, and that it's going to be defined by an active treatment plan or an active plan of care. That doesn't necessarily mean it has to be a formal treatment provider per se, but there does need to be some clinical planning and treatment plan development or plan of care development. I totally could be wrong. I'm just hearing that, and I think right now it's being interpreted a lot of different ways, and I definitely don't understand this space very well because it's not normally our cup of tea, but would love to learn more about it and how we can be a resource, and yeah.
No, thank you for that, Carl. And I think it brings up a really good point that the types of projects that are eligible under this funding are really broad, and that when we're talking about projects that might be a services only project or a street outreach project, that's going to look a little bit different when it comes to how that engagement and how those services are offered versus a transitional housing or a permanent housing project where everyone is in one location altogether.
Can I add one more quick comment? Mm-hmm. We are, and I'm just thinking out loud right now, but we are in a pretty unique space with at least our state plan services, and in terms of treatment, the state has recently created a lot of new types of treatment, one of which is comprehensive recovery support services, or maybe Chloe and Aaron can help me define the exact code.
Community recovery support services.
Okay. Which really allows treatment providers to develop unique treatment plans outside of traditional outpatient or intensive outpatient kind of care. And what that means, I think, for everybody in the room is we don't have to prescribe up to 7 hours or 9 to 18 hours for intensive outpatient treatment. We can create treatment plans in a really unique way that allows us to prescribe only case management or peer support, for example, and maybe they check in with a clinician once a month. They'd still need a behavioral health assessment to determine the appropriateness of that level of care. But I say all that to say treatment in Alaska looks and can look drastically different what I think we commonly assume treatment is, which is come to my brick and mortar location, we're going to do hours and hours of talk therapy, and that's what behavioral health treatment has to look like. It doesn't have to look that way. And I'm just curious, or thinking out loud, of how that could integrate with maybe some of the projects that others are working on or you guys are working on, because I think there's some ways to collaborate on those types of efforts. And I would say that treatment doesn't need to look as scary as it has in the past, or have as much structure in the same ways that it has in the past. And I'd be happy to chat with folks in the room, or help folks navigate some of that if it's helpful.
Yeah, and I think another really good point that you brought up around like the waiver services and what is and isn't billable is the requirement that new projects coming in that are transitional housing, permanent supportive housing, or rapid rehousing projects do have to show a level of leveraged resources that I think would be really difficult to do if you don't have someone who is externally billing for some of those services, or a grant that is already funding some of those other services. I think that coming up with that level of match and leverage out. So this is, sorry, I shouldn't use the term match. Coming up with that term of, or with that level of leveraged services is going to be really difficult if you don't have someone who is either billing insurance, billing Medicaid for the provision of those services, or an entirely separate grant funded program that is overlaying onto that. And in order to do that, you have to have a treatment plan. You have to have, these regular contacts and regular services. And then Yvonne in the chat just put in the information about what is and isn't eligible for the DV bonus projects. Something to call out is that the DV bonus projects are exclusively for serving people who meet that category 4 definition, but the regular bonus funds, we call it the COC bonus funds, are not exclusionary of that population. So it can be on both sides. I do also want to share, this is something that I'm not sure what the outcome of it will be, but want to make sure that anyone who's thinking about applying is aware of both continuums of care in Alaska, so the Anchorage Continuum of Care and the Balance of State Continuum of Care, have submitted letters and requests to HUD for an extension of the final deadline due date for this grant because of the disaster declaration for Typhoon Halong. That was backed up by a letter from our congressional representatives. So it was one letter signed by all 3 of them, also expressing support for an extension of that date. The impacts of the response to that disaster have been felt in our homeless prevention and response system, and particularly with organizations that might be eligible applicants, either renewing projects or new projects coming in. So we wanted to make that case and make that ask to HUD. We haven't heard back yet on what that outcome of that could be, but I wanted to let you guys know that that is a request that's out there. If it is granted, the extension would be for the overall due date of the collaborative application. It likely would not have an answer in time to be able to affect the application for the due date for the project applications. But when it comes to the work that happens after the 14th due date, it could allow for some cushions and extension of time for, things like putting in the eSNAPS applications or gathering some of the supplemental documents that we might need further on in the process. So we will keep you all in the loop if we hear anything back from HUD, but that request was submitted for both of our continuums of care. Also, just want to encourage everyone, if you have questions that come up in between these technical assistance sessions, you can email us at grants@ach.org. There's quite a few of us that get that email, and we'll get back to you. I think we've been running about 24 hours on a response. So if you have any of those questions, feel free to reach out when you have them. You don't need to save it until the next time we have a technical assistance session or a meeting with all of us together in there. Those questions that we're getting are going to be in a frequently asked questions document on our website. So you'll be able to see the questions that are coming in from other potential grantees and what those answers were, and that might answer your question before you ask it. Like I shared, we are pushing things back out to HUD when there are questions that we don't have clarity on, either ourselves or the balance of state continuum of care. We have not gotten any responses back yet. I think we're up to 11 questions that we've asked now. So I'm not counting on getting any questions back or any answers back from them on any of those questions prior to the due date of project applications, which is the 14th. But we can always hope. In the past, HUD has actually not allowed you to have service requirements for your participants. So there's not a lot of HUD guidance on how to set something like that up, or what might be expected. So the template that we have is based on service participation agreements that have existed in other non-continuum of care funded projects. So people should feel free to use that template, adapt it to meet your specific program, or use something completely different. But the gist of what is being looked at in there is something that is signed by the participant and signed by the program delivery person, whether that is yourself as the grantee, or if you have partners or subrecipients, it might be multiple signatures between all of the participants in that person's case management. And just outlining the services that are being offered and the requirement to participate, particularly around the number of hours or number of engagements that are required. So it's fairly high level, but we'll have that out on our website for people to either adapt for their own use or just take it and use it. Either one, of course. I'm really happy to see you all in this meeting. I'm really happy to see so many people who either haven't gotten continuum of care grants in the past or in the recent history, or people who are outside of what we've been able to traditionally fund with continuum of care grant funds. We have a pretty great bonus opportunity this year with just over $1.1 million available. And I think that will really change some things in our community. And, HUD really was pushing with this particular NOFO to get out there and look for people who haven't applied for this funding before or who haven't felt like it fit for them. And I'm really excited for our community. I think our community has done some really great things around street outreach, around treatment services, recovery housing, and being able to encompass those types of programs and services into continuum of care funding is a really great opportunity that we have not had in our community before. And I think we're really poised to do this in our community. We have a lot of this work happening, and now we have a funding source to be able to either expand and do more of it, or better fund the programs that we already have going. So I'm excited to see this many people. I'm excited to get some applications from people who haven't applied for this money in the past and be able to really expand the services that we have for people experiencing homelessness in Anchorage and make sure that there is a fit for everybody. That hasn't always been the case in the past, and everyone's service needs are different. Everything in our community has been and should be person-centered, and being able to offer a program or a service to someone that fits what they need is what we need more of. Laura, haven't forgotten about you. Still looking for that reference. I know it is in here and has information about when you can match up different projects based on the ownership of the property, or what other type of funding is in the project.
Okay. Yeah, and don't stress about it. I can jump in there and try to find it again too. There was something funky, and I just wanted to make sure
There
that,
was.
Yeah. Yeah. No, just whenever. It's all good.
Okay. And that will definitely go into the frequently asked questions as well. So if that's something other applicants had that question on.
Okay, no, that's perfect. And I think we're
We'll have
still
it
in
there for
line
them.
to do, to structure everything kind of the way that we were talking about, so.
Lisa put it in the chat, but just to call out again, deadline is 11:59 p.m. on December 14th. Recognize that's a Sunday. Really just want to give you all every minute that you can get with this application. We know it's a really short turnaround and there's a lot of changes. HUD has a requirement in this NOFO that the project applications in your local competition have to be due no less than 30 days before the due date of the actual collaborative application. And so with that being on the 15th of January, we wanted to have right up to that deadline for you all without getting sideways with HUD arguing about hours and time zones and the actual time that things are due. So recognize that it's a Sunday. Our staff will be available for questions right up until that moment. So don't hesitate to reach out. We'll be monitoring that email all the way up until that moment. So if you have questions, reach out and ask. Don't think that since you didn't have that question until after 5 p.m. on Friday, you can't ask it. You can. We will monitor that right up until that due date. The meeting is just calling attention back to the timeline and letting you all know the process that is followed and what happens after this. So December 14th is when those applications are due. Recognizing again, that's a Sunday. As soon as we have all of those applications in, the handoff happens to that rank and review committee. So that rank and review committee made up of community members who are not part of a project that was submitted. So either as an applicant or as a recipient or contractor, anything like that. They can't have a financial interest in any of the projects that were submitted. So that rank and review team is going to work together to look through all of those applications, compare them back to the notice of funding opportunity and those requirements, and they're going to score those applications. The scoring on the applications is broken down into 3 different categories. There's scores that are what we call NOFO scores, which are how do the answers to the questions line up with the requirements in the NOFO itself. Then there are a series of questions that are what we call objective or system performance measure questions. Those are primarily for the renewal grants, but there are some in there for the new projects as well. Those are things that are often like yes or no. Is this project going to do the thing or not do the thing? And then there are narrative questions. We really tried to minimize some of the narrative questions this year because those take a long time, not just for you guys to write, but for that rank and review team to go through and parse that. So we tried to keep the narrative questions to the information that is relevant to this NOFO and do the best job of describing what your project is going to do and who's going to partner with you on that particular project. So they go through all of that. They individually score all of those applications, and then they come together and pull all of that information together into what is the final scores for each of those applications. That they then create a document that is called the priority listing, where they rank those projects and they say, you know, these projects were the strongest, these projects not as strong. And they make that big list of all of the projects. And we put that up against the funding that we have available. It's broken down in between tier 1 and tier 2. Tier 1 is our projects that are considered a little bit more safe. The funding for projects in tier 1 is awarded first, and then the projects that are ranked in tier 2 is awarded second. They go through all of that, they do that whole process. Then there will be a meeting that is a meeting of our Continuum of Care membership. I encourage everyone to come to that meeting. If you did not submit an application, then you can vote on that ranking. Once that vote happens, we will then publish the Continuum of Care funding recommendations that came from that. You all, if you submit an application, will get an email at that point letting you know, what the outcome of your application was. Once that is done, everyone who was ranked in that tier 1 or tier 2 group will now have a second application that they'll do through a HUD database called eSnaps. If you've applied for HUD funding in the past, you have used eSnaps. If you haven't, we'll help you get an account and we'll help you get that application in. That's the official way of communicating that application to HUD. That gets packaged together with our community application, which is how we are responding to everything else in the NOFO. So how our community responds to homelessness in Anchorage. All of that gets packaged together. There'll be another one of those all Continuum of Care membership meetings where we'll vote on the final package of that application. It will then get posted on our website for public comment for 3 days, and then it'll get submitted to HUD as part of the official submission. So again, that timeline is on our website as well. If you have any questions, absolutely reach out to us. That grants email is monitored by multiple people, so somebody will get back to you fairly quickly with an answer there. We'll have another one of these meetings next Wednesday. So if you want to join again there, you are welcome to. Don't hold questions until then. We'll answer them in the in-between as well. And watch for our website to have a frequently asked questions that are combining together the questions we have gotten through emails, the questions we get through these TA sessions, so that we have that information out to everyone. And check out our website for any updates as we have new links, or if we have new information from HUD, it will all be out there on our website. So thank you again for everyone joining, and I hope you have a great rest of your Wednesday.